Spaying is a procedure that at most veterinary clinics entails removal of both the uterus as well as the ovaries. It's also known as an ovariohysterectomy, and it's something that we recommend doing at about 6 months of age or prior to your dog's anticipated first heat. And we recommend removing these organs at that time period in order to prevent the risk of mammary cancer and other estrogen-responsive tumors later in life. And we know that if we can spay your dog before 6 months of age or before her first heat, we can greatly reduce that risk by about 80%. So most veterinarians and Bob Barker alike recommend spaying as a means to control pet overpopulation. And it's also a procedure that may reduce your pet's urge to roam or seek out the local male. It has health benefits in terms of preventing uterine conditions such as pyometra, which can be a life-threatening infection. And it's a procedure that, like most major abdominal surgeries, it's performed under general anesthesia. And for that reason, your veterinarian will likely recommend doing some blood work ahead of time as a pre-anesthetic screen. And certainly if we're planning on spaying an older dog, doing some pre-anesthetic blood work ahead of time is an especially important thing to do as a safety check. In terms of the procedure itself, at our clinic, every dog is placed on intravenous fluids for the procedure, and they're also intubated, meaning a tube is passed down their airway in order to deliver oxygen as well as an inhalant gas anesthetic. During the procedure, their vital signs like their heart rate, their blood pressure, their respiratory rate and whatnot are monitored very, very carefully. And the procedure itself, depending on the age and the size of your puppy or adult dog, lasts generally 45 minutes to an hour. Usually your puppy will go home to you the next morning or potentially that evening, and the veterinarian at that point will discuss with you home care, so things like perhaps the need to use a Elizabethan or cone collar or a little satellite dish to prevent the puppy from licking or chewing at her incision site. And we'll usually want to see your puppy back in about 2 weeks in order to remove her sutures. And during that time while she's healing, your veterinarian will encourage you to make sure that her activity is limited so as not to put stress on the incision site. If you have any questions whatsoever regarding the spaying procedure itself or your pet's hospital stay, I would encourage you to talk to your veterinarian or veterinary technicians, and they'd be more than happy to guide you through the process. For Halton Insider, I'm Dr. Laura Golding.